We are three combat nurses from World War II in the European Theater of Operations. And actually, this is the first opportunity the three of us have had to meet and really talk about some of our adventures and some of our experiences as very young nurses in World War II. And we would sort of like to dismiss the theory that the medics merely patched people up, and especially in a field hospital, and sent them on, which certainly was not true, and that most people do not realize that actually the nurses lived right along with the men in combat clothes, and we put up with the terrible cold and the lack of the food, but most of all, I think the lack of sleep. Sleep deprivation was probably, as with the men, one of the worst things that we had to face. And we're just going to talk about some of the experiences that we've had. Kate, how about you?
Well, I think it's time that the public knew about the expert surgery that was done in the field hospitals. I'm sure nobody realizes that we had the finest surgical teams available anywhere, teams from the major medical centers of this country, and sometimes they'd be two teams working on the same patient at the same time. And this is all very, very serious surgery. It's not just Band-Aid stuff like it sounds like when you read about it. We were really very proud of the excellent care that went on in our field hospitals. And it was very satisfying to know that when they left us, that they had a pretty good chance of surviving, because they still had future surgeries to go through, most of them. They had a long way to go before they recover and be home. A lot of rehabilitation, physical training or physical therapy, and but they were well on their way when they left the field hospitals. They had a good chance.
Both of us had been in field hospitals, Kate in the 53rd and me in the 57th, but Ruth here has been in a general hospital that was forced into becoming a field hospital. Field.
Yes, when the Battle of the Bulge started, we all of a sudden had no use for the psychiatric staff that we had. So the nurses most of the nurses were evacuated, and there were 10 of us that stayed behind. They also imported a surgical team that came in to help us, and we had from 1,000 to 1,500 patients a day come through our surgical team, and it was done, and a lot of the triage treatment that they use today was sort of invented then, just because you had to, we didn't use blood pressure cuffs because you couldn't strip the patient, get their arms out, put the cuff on, so you ran your hand under the canvas stretcher, and the ones that had the most blood were the sickest ones, and you had to use your instincts and so forth to pass them on to the surgeon to work with them. And it really teaches us a lot about using our
innovation.
To become, and a lot of what's done in medicine today was learned in the field of medicine in the war, really.
And some of the really critical things, especially during the terrible weather where the ambulances had a hard time getting to the hospital, it was really essential that the hospital be as close to the battle lines as possible. And they would bring them in on the litter, and as you're saying, that you had to strip off the clothing immediately or as soon as possible in order to figure out how badly the patient was wounded, because they had lots of layers of dirty clothing on. And they were on this litter, and if possible, this litter was moved probably from the entry area to the hospital, a triage area, almost directly into the operating room and placed on sawhorses. And these were, as you know, the regular farmland sawhorses that are used on farms, but they were wonderful to stack, and you could carry 10 of them in an ambulance, so you could just set those out and move your litter from wherever you were taking care of this patient that had just come in, and move them directly onto these sawhorses. And the patient or the doctors became used to sitting on a stool and operating at that low level. And I think one of the things that probably we do not know much about was the wooden bullet that the Germans began to use at the end. I don't know if you had any of
No,
those.
I don't see.
They were wooden bullets that truly exploded wherever they hit the wounded patient, and especially if they hit the head or the chest area, there was practically no way to save these people, because these splinters from the wood had penetrated the entire body. And these would be very difficult. You would try to comfort the patient as much as you could, and certainly give them morphine and things of that sort. But I think this is difficult. You always like to have hope for your patients, and many of them, certainly when we took care of them in the entry triage area, we certainly had no hope, or not much hope, that they would survive. And the doctors did a wonderful job, incredible, and they worked maybe 70 hours continually. Nobody stopped if there were wounded or sick patients.
Yeah, they kept going. As long as we had any surgery going on or any incoming patients, you stayed on duty until the last one was out of surgery. And that was the beginning of intensive care, really.
Right.
Because before the war, when a patient went into a hospital and had surgery, there was no such thing as intensive care. You were lucky if you had a student nurse come and sit and take your vitals every 15 minutes or so after an operation. But in our field hospitals, we were there. The nurses were in with the patients the whole time, and it was intensive care nursing, although it wasn't called that at the time. Another thing I'd like to mention about the work that our dentists did. Each platoon, each field hospital had 3 platoons, and we operated in widespread areas as 3 separate hospitals, and we each had a dentist. And we thought that the dentist was going to be filling our teeth, and that would be about it. But they spent more time in surgery with facial injuries, wiring jaws and saving teeth, working with the neurosurgeons and the orthopedic people, and they did a fantastic job too. But the patients really got excellent care. If they got to the field hospital, they had a good chance of surviving.
I believe the percentage was 97% if it got to the field hospital or a hospital, that their chance of survival was 97%. And I think we just want to make sure that these people are not forgotten, that we have made incredible progress in medicine because of the things that these doctors and a lot of times the nurses, we had not been taught to do a lot of these things in nurses training. We simply, it was a matter of necessity, and we did it. And I think, yeah.
One of the dangers of handling wounded when they came in was that they were bundled in army blankets, and as you open the open the blankets, you had to make sure that they didn't have hand grenades
Yes.
with the pins cocked on them, hooked to their belts, because we were indoors, and we had a big picture window there that was open so that we could throw them out the window and they'd roll down the hill, because it was that was always the first danger, was that when you open those blankets to check and see that there was get rid of the hand grenades they had, because the pins would be pulled.
But
Okay,
I
cameras
can't see the
rolling.
rest of it.
Yes.
She's got a Ninth Army pen.
It was the regular nurse's uniform, but once we got overseas, I don't think any of us
No.
wore that
No.
uniform.
I
We
wouldn't
really
think
wore combat clothes like the
Just like the men.
men.
I think if you'd worn that uniform, somebody would have said, "What are you
You know-
trying to do?"
Well,
Once in a while,
We
you'd
sure
have
did- we sure
get
didn't wear
called to-
our dress-
in our hospital,
dress
we'd get
ODs.
called for retreat, and we'd have to go get dressed
Well,
up.
we didn't have any of that, or any saluting or anything else once we got in the field.
Yeah. You just did
But-
your
and
job.
look, now, with the Class A uniform, you don't have the insignia on the collar of the shirt as well as on your shoulders.
No,
Why would you do
you
that?
only
Why
wore
would
it
you do
like,
that?
Wouldn't be any point.
you didn't wear double.
Well, I want to say something.
You comment.
Until today, I had never met Kate. I'd never seen her. Thank goodness. Kate treated some wounded guys from my division, the 78th Infantry, from the Hurtgen Forest and later. The Hurtgen Forest was one of the worst battles ever fought, short of the Bulge, ever fought by the U.S. Army. This lady saved a bunch of my fellow buddies from the 78th Infantry when that battle was at its height. I'm glad, bless her heart, I never saw her until today. Thank goodness. I don't have a Purple Heart. I don't want a Purple Heart. I didn't want one then. But if I'd had one, she might have helped save my life.
Absolutely.
I was just one member of a team, remember that?
I know
right.
that,
That's the whole
Kate. I
thing.
hear what you're saying,
Yeah.
but it doesn't make any difference because a whole bunch of guys that I knew owe their lives to you. What do you think about that? I know you were just doing your job. You're just part of the team. I know. So we all were. We all were. We all were. But still, isn't it nice after 60 years, to meet this lady
That's great.
who saved the lives of a bunch of my buddies?
Amen.
I'm still glad I didn't see you then.
Excuse me. I was just bumping into you.
Come on.
I was seeing some of those exhibits there, like the Chesterfield cigarettes. Remember
Right.
when
Lucky Strike is going to
going to
war.
war, the Chesterfield's not a coffin, a carload, come on. What a lot of
But
crap that was.
you know what? The cigarette companies were smart, because they hooked thousands and thousands of
God.
people by giving
Every-
the cigarettes
Every
away.
ra- every
Girls,
ration
now
had
this-
cigarettes in them.
This is
Every
an
ration.
old piece of equipment that
Yep.
we boiled our
Right.
scissors in or whatever.
Didn't have pre-wrapped sterile stuff.
You put everything in a huge autoclave
Sure.
and sterilized
Excuse me,
it that
blow it.
way. That was one of the most important pieces of equipment we had.
I know it.
Today, it's all wrapped in paper, and
Oh,
very
yeah.
sterilized,
Sealed,
but
sterile.
we
Hard
had
to
to,
open paper. Hard to open paper. I know it.
Oh, boy. There it is. One difference, that Thompson submachine gun,
Yeah.
mine had a cut compensator and it's supposed to keep the